In the lead up to the referendum in Ireland, that there was particular spikes in calls for help, for assistance, mental health assistance and suicide prevention assistance from members of the LGBTIQ community who had got to a point of such deep distress around the sorts of things that were happening, the language that was being used in the lead up to the plebiscite. I think that's something we need to be keeping a very close eye on here in terms of the delivery of services, because I think that these sorts of public debates have the potential to have a very real detrimental impact on vulnerable people within our community. And like I say, in this case, I'm talking particularly about members of the LGBTIQ community, but also the impact potentially on their families. And I think it's beholden on every single one of us to be very, very conscious of that and making sure that these sorts of impacts are not occurring, and that if people are feeling as though that they need to be able to access services to ensure that their mental health is going to be okay, and even more importantly, any risk of a sense of suicidality is able to be addressed. It would appear that we are going to be having this big public debate going into the future. The one thing I'm asking is that there is a way that this can occur that is as conscious as possible, that people have an entitlement to feel safe and have an entitlement to be okay.